Assalamu alaikum everyone. So hope you all are doing fine. Welcome back to the lecture. So we started our prosthodontics, okay, in which we did our removable partial dentures in the previous lecture. Okay, so we did our chapter 1 in which we had a basic idea about what are partial dentures, and in this lecture now we will be covering its chapter 2 in which we will be covering our types of prosthodontics, oh sorry, types of removable partial dentures, not prosthodontics. So by the way, you have three types of prosthodontics like FPD, RPD, and CD. Okay, so right now we will be studying a removable partial dentures that are RPD. It's chapter 2, and we will be studying in this lecture about different types of RPD, of removable partial dentures. Okay, so basically, what is a removable partial denture? It is a dental prosthesis designed to replace one or more missing teeth in the upper or lower arch. It is supported by the remaining natural teeth and the oral tissue, and it can be easily inserted or removed by the patient. So, removable partial dentures have two types based on material and from where it taking support. Okay, so on material, it is further classified into three types of partial dentures that are acrylic, cast, and flexi partial dentures. And on basis of support, it is classified into two types further down, that is tooth supported and tooth and tissue supported. Okay, the second type is tooth and tissue supported. So this here is your acrylic partial denture. Okay, for posteriors, see, these are the posterior parts, teeth attached to this denture. Okay, so this is a acrylic partial denture. Then this is your cast partial denture. You see this whole metal thing here. This is your cast partial denture for posteriors and interiors. So this is your third type, flexi partial dentures, given the name because they are flexible. Okay, so this is your flexi partial dentures taking support from interior teeth, and it is basically for posterior teeth. Okay, so these are the types of RPD. So moving on, this is the slide for acrylic partial denture. So we will be starting with our materials, the types of partial dentures subdivided in basis on materials are acrylic, cast, and flexi partial dentures. Okay, so starting from acrylic partial dentures, they are given the name because they are made of acrylic, and acrylic is a material. Okay, so we all know that. So they take support, their entire support from mucosa and underlying bone tissues. There are of three types based on curing. Okay, so acrylic partial dentures is firstly further classified into two types. Okay, based on curing, okay, how they are cured, and based on design, what design you have made of those acrylic material. Okay, so based on design and based on curing, they are further classified. On basis of curing, there are of three types: self cure, heat cure, and visible light cure. Self cure are one that they can start a chemical reaction within itself and completely by itself. Okay, and they get cured. So that is a self-cure material or acrylic partial denture. Okay, heat cure are the ones you give them external heat source, so they start the chemical reaction and get cured. Visible light cures are the one you give them light, external light source, to start that chemical reaction for curing itself down. Okay, so these are the three types based on curing, that is self cure, heat cure, and light cure. Then these acrylic partial dentures are further classified on the basis on design, what kind of design you are making of those materials. So this is a conventional, they are further are the conventional acrylic partial dentures, everyday dentures. So now everyday dentures are like mostly given for interior teeth. Okay, and specifically when one or two teeth are missing, and they are mostly given in pediatric patients. So okay, everyday dentures I'm talking about right now. So everyday dentures also have, like, they have a 3 mm distance from gingival marginal line, and they have a wire stop posteriorly. Okay, This was all about everyday dentures. Then you have third type, spoon or modified spoon shaped dentures. So these are the ones, they don't have no wire stop. Okay, they take support from palatal and gingival marginal lines, and they're also given in pediatric patients. Okay, then is your fourth type, that is section or two-part dentures. So they are given in small mouth opening, and it is made up of two sections. And when they are placed in the oral cavity, they have a magnet button to join them. Okay, since they have two parts, so they also be needing a joining button or joining place or a joining hook or whatever. So they have a joining magnet to join the two parts, to stick them each other. Okay, so this was something basic about acrylic partial dentures. Now these are the advantages, that they are aesthetically more giving natural appearance of teeth, providing a more natural looking restoration. They are cost effective, means they are less expensive compared to other types of removable partial dentures. Okay, they have a simple fabrication process, relatively straightforward, that is, okay, allowing for quicker and easier treatment. Versatility, they can be used to replace a wide range of missing teeth and can be modified as needed. Patient comfort, the soft and flexible nature of acrylic material can provide a more comfortable fit for the patients. Okay, so these are the some of the advantages of acrylic partial dentures, and similarly it must have some disadvantages as well, like all things. So disadvantages are that they are less durable, therefore they are susceptible to chipping, cracking, and wearing down over time, requiring more frequent replacement. They have a bulkier design. Acrylic material used in these dentures can result in thicker, less natural looking prosthetic compared to other options. Okay, potential allergic reaction. Allergic reactions or irritation from acrylic material used in the dentures, gum tissue irritation. The denture base can sometimes put pressure on the gum tissues, leading to inflammation and discomfort. Limited adjustability, more difficult to adjust and reline compared to other dentures, making them less customizable to the patient's changing needs. Okay, so these were some of the disadvantages of acrylic partial dentures. So we have covered our first type of a partial denture based on material, that was acrylic partial denture. Okay, so moving on, we have cast partial dentures, that is the second type. Okay, so cast partial dentures are the ones that are made of metals. Okay, so they have three types: cobalt chromium, gold alloy, and titanium. They are used as aesthetic. So uses of cast partial dentures are that they are aesthetically more pleasing. Patient desires, a patient walked in and you gave them or give him all kinds of old options, kinds of options to him, like we have acrylic dentures, cast dentures, and then flexi dentures. Okay, so he opted for cast partial dentures or he opted for acrylic partial dentures. Okay, so it also depends on the patient what kind of a denture he or she wants. So patient desires: unfavorable maxillomandibular relationship, long edentulous span. Okay, no abutment tooth to posterior to the edentulous span. Okay, so what is an abutment tooth? Basically a tooth from where the prosthesis is taking support. Okay, so if a patient doesn't have a abutment tooth or a tooth from where it can take support for the denture, he can also be given the cast partial denture. Okay, reduce period support for remaining teeth, the teeth that are present already in his mouth, okay, that don't need replacement, have less period support. Okay, so if such a condition arises in oral cavity of the patient, you can also give cast partial dentures. Need for cross arch stabilization or excessive bone loss within the residual ridge. So these are some indication of cast partial dentures. Okay, advantages of cast partial dentures are that they are more durable, especially those made from cobalt chromium or titanium alloys, and are highly durable, resistant to wear and tear, lasting longer than acrylic alternatives. Improved aesthetics can be designed to blend seamlessly within the natural appearance of the teeth, enhance stability. The robust metal framework of the cast partial dentures offering superior stability and support, preventing unwanted movements or rocking during function. Versatility replaces a wide range of missing teeth and can be tailored or accommodate to various oral conditions and patient preferences. Okay, reduce risk of tissue irritation. Okay, less likely to cause irritation or inflammation of the gum tissues compared to acrylic dentures. Okay, acrylic dentures can cause more irritation and inflammation, and they cause less. Okay, so moving on, the disadvantages of partial dentures are they are expensive to fabricate than acrylic partial dentures and requiring a great investment upfront. Complexity of fabrication, they are hard to make. Their process is really like you may say require specialized expertise for that. So they have a complex fabrication process. So potential for allergies, some patients have allergic reactions to metal and alloys. Okay, so which are used in the cast partial dentures. So yeah, patient can't wear such dentures, so they can't be given this. That is a disadvantage. Okay, so difficulty with adjustment, making minor adjustment to cast partial dentures can be more challenging compared to acrylic partial dentures and require specialized dental expertise here. Okay, so then the last one is that potential for corrosion. Obviously metal corrode, so the depending on the metal alloy used in the cast partial dentures may be susceptible to corrosion over time, which can affect their longevity and appearance. Okay, obviously no one wants a corroded prosthesis in his or her mouth, so that is also one of the drawback of cast partial dentures. Okay, then we have a flexi partial denture. This is the third and final type based on materials. Okay, we covered acrylic, we covered cast partial dentures. Now we are on third and final type of partial denture based on material, that is flexi partial denture, given the name because they are flexible. You can see in the picture as well, in this picture here, that it's bending. The pressure is being applied by the fingers, okay, on the at the end of the this denture, and it's bending. Most of the partial denture that are, they are not flexible. So there are the type of removable partial dentures made from flexible thermoplastic material. It is of two types, nylon and well passed. Okay, these are two types of material from which you can make a flexible partial denture. Okay, so one of the type is that you can make them of nylon, and the other type is that you can make them of well passed. The advantages of flexible partial dentures are they are lightweight, flexible and comfortable to wear, providing a natural looking and discreet solution for missing teeth. And okay, this is limited durability is your disadvantage here. Okay, flexi partial denture, while comfortable, may not be as durable as dental material traditional metals or acrylic partial dentures, and may require more frequent replacements or repairs over time. Okay, so they are less durable if more of the forces are applied here, or if there is more bending of this material. Obviously everything has its limit, elastic limit, so it'll break. Okay, so here comes the point that if it's break, then there is more frequent replacement or repairs over time. Okay, so these were the three types of partial dentures based on material that we covered right now. They were acrylic, cast and flexi partial dentures. Now moving on to partial dentures made on the basis of support, from where they are taking support. So we have two types of those, that is tooth supported prosthesis, and the other one is the tooth and tissue supported prosthesis. So the tooth supported prosthesis are those that are taking completely entirely its support from the tooth. Okay, so natural tooth supported FPDs are present. We have removable partial dentures and implant supported RPDs. Okay, RPD can be designed in a number of ways to allow the use of support from the remaining teeth and the supporting tissues for stability and retention. RPD and the abutment tooth should be designed to take full advantage of the tooth support. Okay, so they should take full advantage of the tooth support, the abutment tooth. Okay, so the tooth support that is present should provide the vertical support, restrictive angle of dislodgement, okay, tooth bound situation, stability under functional load. Clasp should be designed to encircle more than a half of the tooth circumference to withstand horizontal chewing forces. Clasp is like a hook that is that encircles your tooth from where you're taking the support. Like, see, you see this thing is a clasp here, okay? This cursor on which I'm moving this right cursor, okay, this thing is a clasp. We'll be studying clasp and other parts of this removable partial dentures separately in other videos. Okay, I'll be explaining class in detail in one of the coming lectures. Okay, so don't get panicked that we don't know what is a class or that. We'll be going with that. Okay, so the second type and the final type of the RPD is tooth and tissue supported prosthesis. So tooth and tissue supported prosthesis are those that are taking support like from the tooth and from the tissue as well. Okay, they are taking support from two areas. Your in your oral cavity, that is from the tooth that is present, the remaining tooth that are present in your oral cavity are providing support to that denture, and the tissues present in your oral cavity. Okay, so the residual ridge should be used to assist in functional stability of the prosthesis. The prosthesis should be designed to allow functional movement of the residual ridge mucosa. Okay, so if you're making a tooth and tissue supported prosthesis, so residual ridge is your tissue. Okay, so if you're taking the support from the residual ridge, so residual ridge have its normal movement, that is from 1 to 3 mm of normal movement is present in your residual ridge. Okay, so if you are designing a prosthesis that is taking the support from residual ridge, that prosthesis should allow the natural movement of the residual mucosa of 1 to 3 mm. Okay, I hope I'm clearing this out. If not, comment it down and I'll explain it again in the upcoming videos. Okay, so the next point is this prosthesis, that is tooth and tissue supported prosthesis, achieve dual goal, that is to allow appropriate functional stability from the tooth and allowance of the anticipated vertical and horizontal movement of the extension base. Okay, so there are two types of movement occurring in your mouth, that is what, not only two types, there are oblique forces, there are many kind of forces of movements occurring. So basically vertical and horizontal movements are more anticipated. Okay, so there should be allowance by the prosthesis for these movement. Okay, and the class retained partial dentures are mostly used, mostly when the dentures are made, partial dentures are made, they have clasps. Okay, so these things, these tiny little extension or hook like things that I explained you like right now. Okay, so most of the partial dentures have these clasps and they provide you support, or like they help you sticking the denture in your mouth in simple layman terms. Okay, when you want to place the denture that it doesn't move excessively. Okay, so you give them these clasps, these hooks to, okay, like fine, just sit here down. Okay, so these kind of support they provide. Okay, so mostly when the partial dentures are made, they do have clasps. Okay, so these were all kinds of types of partial dentures, removable partial dentures here that we studied. And then we have, okay, and then we have the phases of denture services, partial denture services. When you're making a denture, what kind of services you're providing? So we have six phases: first, second, third, fourth, fifth, and then sixth. In the first phase, we make appropriate diagnosis. We educate the patient for the denture, that he is going to have a denture, how you are going to use a denture, how you're going to place a denture, how you're going to take care of the denture. Okay, so there is the first phase of patient education. Why do you need, first thing is that you have to counsel down the patient, you need a denture here. Most of the people don't want a denture because of their expensivity or like this kind of thing. Okay, so you have to educate the patient for these things. Then second phases of treatment planning, design of the RPD, what kind of RPD you are giving, what kind of material you are going to use for that RPD. Okay, treatment sequencing, execution of mouth preparation. Okay, these all things come in your second phase. Then you have third phase, the provision of adequate support for distal extension denture bases. Okay, then the fifth phase, initial placement procedures and adjustment of. Then you have a sixth phase. Then you have sixth phase, final placement and follow-ups. Okay, so that'll be all. Okay, so that'll be all about this in this lecture about RPDs. And okay, if you have any query, you can always comment down. I'll explain them in the comments, or I can like upload a video in the upload that part in another lecture or something like that. I can always do that for you guys. So if you have any query, if you don't get anything in this video, always comment down or share your thoughts. So like, comment, subscribe and share my channel, and like and comment on my videos, and keep supporting me. So, and also follow on my on me on Instagram page, that is goes by the name of Dr. Barira Mushtaq. So yeah, that'll be all. Allah Hafiz, thank you so much and take care. Bye bye.